us a little bit about the process of collagen and how it plays a key part in the skin as far as the youthfulness and proper things that oxygen and that since you're a registered nurse,
Okay.
explain to our viewers and guests about the collagen.
Well,
benefit.
collagen is the actual structure underneath the skin. It's the foundation and lattice work that supports our skin structures. When we're young, our collagen is like a tight woven braid, and as we age, that braid loosens and lengthens and our skin starts to sag. So we do have a new treatment available to target that collagen that we're really excited to talk
Yes,
about.
we
Really
are.
excited to talk about. It's called Ultherapy, and Ultherapy is the only non-surgical procedure that targets that collagen. It targets the deep tissue structures with ultrasound. We use ultrasound to look below the surface of the skin, and it targets those deep structures to tighten. And when your collagen tightens, your skin lifts with it. So Ultherapy is brand new. It's only one treatment is usually necessary. Improvement continues weekly for up to 6 months with the gradual thickening of the collagen. Now, we have had several patients come in for rechecks in the past week, and all of them had sort of the same response. They said, you know, it's so strange. I can actually feel my skin tightening inside. It's almost like shrink wrap. I can just feel it tightening. So that's been a really great response.
Now, we do have some patients that might have more severe laxity that might benefit from more than one treatment. But ultrasound has been used safely for over 50 years, just to let everyone know.
Wonderful. I'm impressed with this new therapy because I'm familiar with what we used to call the non-surgical facelift, but after Kim and Jane explained this new procedure to me, I just think it's very exciting and beneficial for those people who would like to get a facelift or have some type of facial improvement without going to a plastic surgery and having the risk of whatever comes.
It's an
from the-
excellent alternative to that. It's an excellent alternative to somebody who wants a more natural approach with no disruption to the surface of the skin. So
And there is no downtime. You can immediately resume your normal activities. Some patients might complain about a little bit of soreness along the jawline, but that's just due to that bony area. But other than that, no downtime.
And who doesn't want a tighter neck and a firmer jawline and a lifted brow? So
Because I often see people with firm face and the neckline, you know, it looks a little saggy, and this procedure is perfect for something like that. And these are all procedures that we could incorporate in our lifestyle as we're looking to be healthier, living longer, healthier lives, and looking fabulous and aging gratefully. Incorporating these procedures in with your healthy eating and whatever you're putting inside your body to show on the outside. These are just excellent added benefits to growing and aging gratefully. And I just love them. And I would like to have Kim and Jane tell you a little bit about their locations, their website, and how to contact them to come in and get the consultations and get your treatment started.
well, we have 3 locations. We have a location in Macomb Township and in Roseville and in Grosse Pointe. And our website is www.eastsidegynob.com. You can click on aesthetics and see all the services there that we offer. And if you're interested in Ultherapy, it is spelled Ultherapy. And you can go to ulthera.com for their website and check out some before and after photos. Or definitely come in and schedule a consultation so we can tell you more about it.
Excellent. Well, ladies, I am so honored to have you here, and I hope you that are viewing and watching today have been greatly educated and come in and see Kim and Jane and look into some of these procedures and services that they're offering. I know that you'll enjoy them and you'll keep coming back just like me. So thank you so much for being
Thank you,
here.
Carolyn.
Thank you,
And
Carolyn.
look
We
to have
appreciate
you
it
back
very
again.
much.
And we're going to take a quick break, and we have another guest that's coming in from Eastside Gynecology and Obstetrics, and that's Dr. Elizabeth Somerset. We'll be back shortly. Thank you. Thank you for getting back, and we are here with Dr. Elizabeth Somerset from Eastside Gynecology and Obstetric, and this is a clinic that I have been a patient of for several years. Dr. Neera is one of the top GYN doctors there, and we have Dr. Somerset here today to talk to us about some of the cancers that women face today. And doctor, we're going to have you tell us a little bit about the Eastside GYN Clinic and what are the services you provide there, and let the viewers know that this is one of the clinics to visit.
Here at Eastside Gynecology, we provide the entire gamut of care for young ladies all the way through elderly women through menopause. We cover infertility, all of obstetric services, and all of gynecologic services. We screen for cancers, and just anything any woman would need, we are available.
Excellent. Doctor, with the rate and increasing rate of breast cancer, and along with cervical and ovarian cancer, what are some of the key and important things for women to be aware of to get on top of early prevention and detection? Is there a certain age that women should start being tested and getting their exams to prevent a lot of these cancers, especially breast cancer?
Well, one of the major cancers we cover, as you mentioned, is cervical cancer. And young ladies are going to come in and start getting screened for cervical cancer and for the virus that causes cervical cancer. As a person ages, then they get in more likely to develop breast cancer. Although it does occur in younger women, the highest risk for developing breast cancer is actually older age. So as you get older, breast cancer, ovarian, and uterine become more important. The younger girls, in addition to cancer, are going to need screening for sexually transmitted infections. We want to protect their fertility and make sure they don't have issues with that down the road. So what we're currently recommending is that young ladies come in at age as soon as they have sexual intercourse, so they can be protected from sexually transmitted problems. If they're not having intercourse, we recommend the first age is 21 for an exam, providing they're not having problems. And after that, they need to come in every year to be screened and discuss any other healthcare risks and gynecologic risks.
Okay. So for you young women out there who are not really familiar with taking care of your health, I highly advise you and recommend that you go in and get examined and treated for cervical cancer or any type of diseases that may be prevalent when engaging in sexual activities, because so many times we don't take this serious, but it's very serious, and it's as the doctor said, it's increasing and alarming. So please at some point and immediately take it to get yourself in there and get examined for these